Welcome, everybody. We are joined today by Jake Buckley-Fortin, the CEO and co-founder of eHana. Jake, welcome.
Hi, thanks for having me.
Absolutely. So maybe you could start off by setting a little context and telling us a little bit about who eHana is and what you guys do.
Yeah, absolutely. eHana is a health IT vendor. We support mission-driven human service and social service agencies. Our providers really run the gamut of social safety net providers and healthcare services. They serve individuals with IDD needs, outpatient behavioral health, substance use and abuse. There are day programs, residential programs, step-down programs. They serve children's, adults, seniors, and there's a sort of a healthcare component to what they do, as well as a social service, sometimes being referred to as sort of social determinants of health component nowadays, food insecurity, domestic violence shelters, housing, et cetera. So our providers really run the gamut, and we provide software systems, electronic health records, electronic systems that help them track the services they provide and the clients, consumers, enrollees, members that they serve, so they can operate more efficiently and effectively given the myriad of complex regulatory and contractual requirements they operate under.
So you are the first.
Long story short.
Yeah. So you are the first technology company that I've gotten to interview that serves the health and human services space, which I'm really excited for. So just before I jump into the human service side, on the technology piece, how have you guys been impacted by COVID-19 as a electronic medical records company?
Yeah, and I'll say just to start that the impact on us pales in comparison to the impact on the organizations that we serve. And given that this is June 1st, 2020, for anybody watching this in the future, COVID is almost off the news cycle at this point, which is pretty incredible given that it's an ongoing pandemic. And so thinking back to the early days of this, 2 months ago, it's sort of interesting to try to recollect what business was even like prior to this transition. So as a tech company, for us, I would say that we were particularly well prepared to move abruptly into an entirely remote way of working. We have a great office in Boston. We love it. We're, have always focused on having a gathering place for staff and organizations that we serve to come together. But really, we also support a pretty meaningful and diverse fully remote team. So for some of us, myself included, that we're more used to having a stable office environment.
You were ahead of the game.
The transition was more challenging for me personally, I would say, and a couple other people that really, leaned on that office environment. But yeah, as a company, we were ahead of the game, and we have similar, operational challenges to everybody else, our customers included, but any other knowledge work. The biggest one at this point has to do with having kids at home, and we have a lot of parents of young kids. That's myself included. Very challenging on a day-to-day basis, and we want to be as supportive to those people as possible. But the usual gamut. We've hired and onboarded a couple of people in a fully remote way. That was new for us, and we've got a number of immune compromised individuals on staff, and so trying to figure out how to navigate a potential reopening down the road, though we're not in a rush, is also an interesting conversation. So fairly typical, but we have some advantages in that we're more prepared to go remote.
And you have the blessing of being able to work with so many different providers that are out there. Not only that, but support them with their data and what they're seeing, and throughout this whole pandemic. How have you seen these providers, these nonprofits, be impacted by COVID-19?
It's really challenging to relay the scope of sort of the changes and impact on these organizations. I'm mostly exposed to the technology side, but since I engage, like you do, Eric, with so many of the CEOs at our organizations, you get a good view into the day-to-day challenges they're experiencing. So for those groups, we're talking especially about the organizations which make up a healthy percentage of our customer base that serve medically fragile individuals or have day or residential programs, for people with serious mental illness or persistent, intellectual developmental disabilities. There's risks to clients, there's risks to staff, there's lots of exposure to COVID. We've had a meaningful number of clients and staff for our our customers pass away due to COVID. They had in the early days acute needs for PPE, though that's thankfully largely been mitigated at this point. And I think overall, what we saw was that the need for services did not diminish in any way, despite the inability to deliver the services in a physical location. If anything, the importance increased. You've got massive unemployment. You've got people, with mental illness, anxiety that's exacerbated by the lockdown and social distancing. And you've got a real disruption to the treatment processes that were, for some individuals, extremely long-standing. Some examples are, we have organizations that have been serving the same individuals in a residential or day program for 35 years. So to abruptly end that relationship, I think is really challenging. So these organizations faced significant hurdles in the early days, especially.
Yeah, we've seen a lot of CEOs just having to adapt so fast. I mean, the pace of change, and before COVID, we talked a lot about, as a company, just how technology was creating pressure in the nonprofit space, and then COVID just strapped a rocket to that thing, and exponentially boosted it, and people that the leaders that were trying to drive a lot of change in the technology space or in the change space were able to do incredible things in days or even hours versus years and months. I mean, so the units of measure in terms of time have also had a rocket strapped to them. It's been amazing to watch.
Well, that's I think one of the biggest takeaways here was that these organizations that we both work with have never been known for their rapid technology decision making, right? If anything, they've been, as a sort of like this, then there's healthcare, then there's human and social services in terms of technology adoption. And I think I've never seen anything like this. The pace of making, the scale of the decision making was so rapid. It's the first time I've seen organizations really think of technology fundamentally not as a cost center, but as a way to enable quality services. And when you frame technology decision making that way, it totally changes the conversation at the executive level in these organizations to say, what's not the cheapest telemedicine system, but what's going to enable us to provide the best care. That's a pretty significant and abrupt transition to happen, literally in a single week, from 1 week business as usual with paying attention to the pandemic to, making some tough decisions. And those continue to this day. I mean, we're really we're not in a post-COVID era from a public health perspective, but we are in a post-COVID era from people are now making decisions in this new context, understanding that they can kind of move more rapidly than they might have been able to before. So it's fascinating, and I'm sure that many business articles will be written about these decision-making processes in the years to come.
So as they move more rapidly, right? So how? Because technology can be something that exponentially amplifies your capabilities, your quality, or just your opportunity, right? So how can technology solutions support growth and scale for organizations? Because I've got a lot of CEOs and leaders that are looking, they've come out of crisis management mode, they're looking over the horizon, and now they're wondering, what to do. And I think there's several different, solutions and answers for that. One of them is technology, but how can you leverage that?
I think a lot about the founding story for us as eHana. So we are based in Boston now, but we actually started, our background is we started in Honolulu, Hawaii. That was where the company actually got started, and where several of our customers remain. And the reason we started there, I'm from there originally, but the impetus for building the first version of our technology back in 1998, 99, was that we had organizations that provided services on multiple islands, physical islands. And they were literally flying supervisors to each island to collect paper charts, to do supervision, and to just enable the bare minimum of oversight and compliance for their programs. And so when we implemented a web-based electronic record for those programs, it was a significant game changer because it allowed them to have real-time visibility into the services, the demographics, the documentation, the assessments, the screening tools, et cetera, that were being provided in these geographically disparate locations. That is the first thing that I think of when I think of technology supporting growth and scale, because most of these organizations, despite being quite large, they sort of, the largest of these groups that we work with are sort of akin to a small hospital, in terms of scale. And they're already fairly diverse geographically. They might have a couple hundred residential homes. I mean, these are big groups, but they tend to be pretty contained geographically.
Mm-hmm.
And they're going to be a North Shore operation or a Cape Cod operation or a Boston operation. That I think is potentially over. I mean, I think you with the adoption of technology, the way we're seeing it, and the delivery of technology in a telehealth model, you have the ability to leverage your resources, maybe an individual with a clinical expertise that's pretty rare, on a much bigger geographic stage. And so, the number one thing that comes up to me is, as I saw happen in Hawaii, is that you really begin to unleash the restrictions on the geographic reach you can have. And that comes with pluses and minuses for the groups that we work with. I mean, the plus is these ambitious organizations can view their mission much more broadly.
Mm-hmm.
But the minus is that there's really no barrier to entry for organizations that market themselves well to begin to, if these groups are fairly competitive oftentimes, and to begin to sort of encroach on what people might think of as their turf. So yeah, technology.
Marketing becomes more of a factor too, right? Like and that's not been a typical area of strength that these organizations should start to think about, because they are competing upon brand reputation around the quality and services.
Absolutely, yeah, and I think that's going to become absolutely crucial. And it's not marketing to the payer, which might have been one of the traditional, the state.
Sure.
Going after contracts, which is a big area of emphasis, I think, for a lot of these groups historically. We look at the immediate changes from this crisis that we've seen. Obviously, there's a huge shift to telemedicine and telehealth, but not just telehealth, it's delivery of services, of all sorts of services that we might have been, totally mind-boggling. We saw, for example, our intellectual and developmental disabilities day hab programs really crater in terms of volume of services provided in the weeks after lockdown. But very quickly, within a couple of weeks, that number crept back up again to be essentially equal to the previous amount of documentation they were completing in our systems, which is wild. It's a day program with a physical location that has no physical location anymore.
Yeah, right. They were doing it all virtually, right?
Exactly. They're doing it virtually. So this is not a telehealth program. This is like a tele-day services program. And that's, sort of unbelievable. So the scale at which virtual delivery of care has been adopted and deployed it's unbelievable. And we can chart that in our systems and see this, math. I mean, we had, 1% of services being delivered in a telehealth manner, going up to 99% of services over a period of 2 weeks, which is, just think about the scale. And when we and I had always considered, the telehealth side to be, let's say, psychiatrists, really high demand, difficult to recruit, difficult to retain sort of services that can then deliver care to individuals, maybe even in a clinic setting or an office setting, but on a screen, right? This has shown that, as a matter of fact, you can deliver a wide array of services directly and virtually, in ways that were never, I think, contemplated ever by anybody. Even the most aggressive technologists in the human services space probably would not have predicted the level of relative success. Now, there are people who are difficult to access with technology. That's why Medicare has loosened up some regs. And there are people who don't adapt well to this form of care delivery. And that's always going to be the case. But the reality is that a huge number of people have had a lot of success and great outcomes as a result of the adoption here. So, I think it's going to take us a long time to absorb the lessons of this period, I think.
Well, just in a short period of time, I've heard some really wonderful success stories about telehealth, telecare. I think whatever we call it really depends on the organization, but just that virtual presence in better show rates, better engagement, more detailed conversations. I guess, maybe being face to face put up some potential barriers, or having to physically get somewhere. There are a lot of positives from this, and I'm really excited to see what the data looks like over the next year.
Absolutely. I mean, it's really amazing. And anecdotally, some of the things we hear is shorter services, more check-ins. People are available. Now that piece of it is not going to last forever, right? We have to, just like I say with our staff, that work from home with a kid and without the ability to go to a coffee shop is not work from home. It's like lockdown work from home. The accessibility on two fronts that we're seeing right now, we're having a lot of success because the clients are accessible. No-show rates are zero, essentially. And the multidisciplinary teams are accessible too, which is huge. Initially it was a little tough, but now it's a lot easier. The primary care providers are accessible. The psychiatrists are accessible. Everybody, nurses, everybody on the team is accessible. And by the way, so are your connections at the payer level. The state entities are very available right now. So that's not going to last forever, that piece of it. But I think we found that we can do a lot more work virtually than we thought possible. That things that previously would have happened in person.
I think the evolution of business models is fascinating to see. And one of the things that we do for clients is help them with strategic planning. Mm-hmm. So help me help my clients, right? Let's talk about the future a little bit. What does data look like down the road? 5-10 years down the road, how important is data? What should CEOs and leaders or chief technology officers, what should they be looking at? What should they be thinking about? To start gearing up and getting ready for the coming decade, because the world's changing and business models are adapting at an unbelievable pace right now.
Yeah, a lot of these organizations are relatively data-driven already, but they have a long way to go. I think data is such a broad topic right now, or just in general, that it's almost hard to, it's like saying, how's water useful? It's
right.
Just the lifeblood of these organizations going forward. So you've got considerations like informing care on an individual level through access to data, right? So I'd like to know, when I meet with an individual that has serious and persistent mental illness, when was the last time they were admitted to inpatient facility or visited the ED? I want to know who they're seeing within our organization, who they've had contact with recently. I want to know what the outcomes are on their latest assessments, or what their diagnosis is, what meds they're on, et cetera. So there's informing individual care. And then there's the population health level data, which for some of these organizations, as they get scale, really is meaningful. You can begin to stratify your population against different comorbidities or geographic areas, and begin to make some strategic decisions based on this sort of stratification organization of your patient population. All of that informs your decisions on outreach and engagement and services. And I think it's only going to increase. We talk about more geographically broad organizations. There's going to be increasingly a layer of management that is making those decisions based on dashboards, analytics, business intelligence. These are all mission-driven organizations, so I'm not worried about them losing touch with the services they provide. I don't think we're in any danger of that. But I do think that we're going to see emergence of a lot more data-driven decision-making in the coming years.
Yeah, I like how you delineate between those two things, right? The care and the data at the individual level, and the population health, because the care at the individual level is the quality measurements, the engagement piece, and moving the needle for that one person. But then maybe looking at how you create predictive analytics or move the health of mass populations, especially around things like the social determinants of health.
Yeah, and I think a lot of the data that's going to drive decision-making for these organizations isn't generated by their own internal teams. And so when you talk about data, predictive modeling, analytics, and business intelligence, a lot of that's going to drive that is interoperated data, is data from external sources. So that could be admissions information from hospitals. It could be data from the state or payers. It could be data from partners that they have, that maybe they have a van company they work with that provides transportation that they have data from. And it's, as we've seen in the private sector and in the hospital systems, it's sort of catch as catch can. People are trying to be as informed as possible within appropriate bounds for the individuals they're serving, and be able to be as responsive to them as possible. We've done a ton of integration projects at eHana. Some of them are one way, like when people create an assessment for children for one of our programs, we send that automatically to the state to ensure that they're completing their contractual requirements under the programs they provide. So there are a lot of these, there's hundreds or thousands of these individual bespoke integrations that then inform and can be modeled and charted and graphed and displayed on both an individual and a population health basis. So it's a really exciting time.
So during this time, it's just been so clear that you can see the fragmentation as well in the system. So a lot of the good stuff in driving towards the change in technology, but it also highlights kind of where things are fragmented.
Yeah.
Right. Either from one agency talking to another, or just a standardized use of systems and things like that. How do you see that evolving?
I struggle with an appropriate way to discuss this topic, because
it's brutal. Because there's so much opportunity, but just look at like a provider. How do they integrate with another organization or share data and things like that?
You kind of gotta clean your own house first, right? So a lot of these organizations are very siloed, right? And if you talk to their senior leadership and you say, show me your portfolio of services, that if I'm somebody with a certain IDD, diagnosis, or somebody who has an addiction issue, and I enter your organization through the front door, what are the services available to me? What are the array of things that you can do to provide the best possible outcome? Well, that's not at all how most organizations are constructed at this point. They're very much siloed around the contracts or payment models and reimbursement models, right? And that's not, I don't mean to say that to, have to hit on, any organizations. That's just the natural way in which they've evolved. They've evolved opportunistically pursuing contracts that have been available to them, and appropriately so. But one of the things we've seen in the COVID era, one of the biggest shocking lessons is the level of innovation and the level of collaboration within these organizations. And the most clearest example for me is, over here you've got an outreach, a care coordination program that has a lot of outreach. And over here you've got a residential program. Now the residential program is some of them are shut down, not all of them, but some of them are. A lot of organizations have borrowed their residential providers and used them in other programs. And not that that never happened before, but the scale to which that flexibility, where appropriate, they're leveraging their resources to meet the needs of people they serve, that's totally new. And so I think if we see sort of a gradual de-siloing of these organizations, that's going to benefit everybody. And then the ability to integrate with other organizations become a little more natural, because it's more of a question of, what services do you provide, what services do we provide, and how do we combine those to be as strong.
And so technology can help get your house in order is perfect, right?
Yeah.
So in order to, in what you're saying, I just want to kind of translate that to make sure I'm hearing you correctly, is that when you're doing person-centered planning, you can kind of use technology to follow a person across the silos, departments, divisions of an organization, which helps to break down those walls and those barriers.
Yeah, and we don't need to get into it in this context, but traditionally, and even today, that's extremely difficult to do. And that has to do with the compliance and contractual requirements that every individual silo, every payment, every model requires of you. It's difficult because if you run a community-based service over here and you run a children's in-home service over here, the treatment plans are going to look quite different because you're operating under different models, under different contracts. So that's sort of the goal, but it has proven to be quite difficult to move in that direction. And not to mention, you've got staff that may have worked in a program for 20, 30 years. And so they've got a certain way of operating that may have to be reassessed. So it's something like the impact of COVID has an opportunity to shake a little bit of that loose and to make us really reassess the models.
Yeah, and I think, with the future and so where it's heading, technology is is such a powerful thing to amplify just a lot of things, whether that's internal communication, quality, or just managing the complexity of massive systems. You know, as more and more CEOs start to explore different types of solutions, different types of technology options and things like that, you know, what advice would you give to them about, you know, overcoming some of the barriers, the obstacles that are coming down the road, which are all opportunities, right? But, you know, they're opportunities that maybe need some, you know, thinking, or there's a lot of change involved, or they're massive scale projects, because, you know, technology solutions can be a really powerful thing. And, you know, you want to make sure you're stepping off on the right foot. But, you know, what advice would you have for CEOs that are looking at, you know, change and adopting technology?
It is all about the team that you have, and making informed decisions about technology adoption. It's such a cross-functional, you know, multidisciplinary process. You can't have your IT department necessarily driving all your decisions, because
Right.
you're going to then impose workflows and processes on the rest of your team that may not be totally appropriate. Now, a lot of groups have figured this out and really have engagement, stakeholder engagement from across their organization. But I do think that that's one of the challenging aspects here, especially when the CEO is a change maker, that you don't top down things. Even when we're trying to make rapid decisions, one of the ways to limit the likelihood of a successful adoption of a technology is to really top down that decision and sort of force it on people. Now, we're in an interesting place right now where a lot of the technology options like Zoom, which we're meeting through here, or Microsoft Teams or Slack, et cetera, are very user-friendly. So if you top down a Zoom in your organization, you're just not likely to get a lot of pushback, because
Sure.
people can figure it out, right? That's a little bit different than things like, frankly, what we provide, an electronic health record or your HR system, where it's really got to be an inclusive process. So despite us wanting to move quickly in this new environment, we still need to, you know, have quality change management processes that enable us to adopt technology in responsible ways. But like I said earlier, you know, it's not just cost. It's also, how does it help you to pursue your mission and vision? It's funny you mentioned this, because we have a giving process, a grant-making giving process, eHana Giving. It's on our website, where we give grants to organizations for health IT and telehealth adoption. And what we saw in our spring giving process was that there was just too much demand. So we pulled forward our fall giving into the spring so we could support more organizations, because they were all, you know, getting Zoom or getting tablets or training their staff or getting internet connections for their staff or their consumers. So the costs are really incredible. And I don't know if that answers your question, but
yeah, no, that's great. I mean, it's just, I know there's a lot to think about, you know, and I know there's a lot of barriers and you know, to overcome.
Yeah.
But I love your you know, push it down to the front lines, or push it down several levels. One, those are the people doing the work, so they'll have the more feedback for you, you know, and can customize things as needed.
Yeah, I think also there should be a recognition that the window of opportunity here may be limited.
What do you mean?
Well, you know, I know that other people have mentioned this on when they've talked to you, but everybody's nervous about the fiscal year 2021 budget. There's been a lot of support, at least in Massachusetts, from the state and the feds and the payers around supporting telehealth and dispersing funds to support additional costs incurred as a result of COVID-19. But boy, it's, you know, the state cannot print money. So we find ourselves looking down the road at potentially some very challenging times for these organizations. And that's really going to separate the wheat from the chaff. People have to operate efficiently. They have to have low cost structure, you know, and with the high unemployment, this need for services is just as high as ever or higher. So I think it's going to be a really interesting and challenging time going forward. Technology is going to drive a lot of the success. At the end of the day, just like it always is with these organizations, it's going to be about motivated teams and mission-driven people. And, you know, It's
Yeah, I mean, just working with some of my clients, it's amazing to watch what they can do with limited to no resources, because these aren't for-profit companies, right? So they're not sitting on big fat margins from state contracts, right? They're operating on razor thin margins and doing
small reserves. Yep.
in amazing work with it.
Yeah.
But things are changing, and business models are adapting. What do business models of the future look like for human services? If you were to like put your futuristic hat on and look over the next 5 to 10 years, what type of things are going on?
Well, yeah, it's interesting because one of the challenges with the coronavirus COVID-19 pandemic is that it takes our eye off the ball with some of the major, at least in Massachusetts, related to the 1115 Medicaid waiver, major reforms that have been underway for several years that support exactly the kind of future state that we're trying, that is even more relevant in this environment, which is a value-based population model of care, where you essentially say, here are the services I can provide, here's what it's worth, and here's the population I can serve. And you get a bundled or PMPM payment. You take on some risk in case of overspending. And you provide a wide array of that you deem appropriate under whatever model you think is best to serve that individual. That's something we've been moving slowly in fits and starts to. One of the biggest initiatives that we've been involved with is the Community Partner Initiative.
Sure.
Mass Health, ACO Community Partners. And long story short, this is a care coordination model that it's a very lightweight and flexible model of care for people with both behavioral health issues and also people with long-term services and supports needs. And this program in particular, where they're paid a per member per month fee and have some certain expectations around outreach and engagement and getting people enrolled with different services and making sure they go to their primary care provider, et cetera. What was amazing about the post-lockdown, post-March 15th or so era for the Community Partner Program is we saw a dramatic increase in activity and engagement in that program. And I think that's because it's emblematic of a new model that is likely to be successful in the future, which is really this care management kind of, identifying the individual, looking at their whole person, all their needs, and using technology potentially to connect them with targeted supports that serve them best. If you think about what's more amazing is that prior to the community partner ramp up a couple of years ago, we didn't have that function being served. No. So you had people with very complex healthcare and mental illness and IDD needs for which there really wasn't that coordinating entity, So that's going to be a critical piece of it. And then I think a value-based model for a lot of the other services really begins to come together if you were coordinating care effectively.
Yeah, I mean, we've always talked about how, human services is moving to that healthcare model where, you have healthcare systems, that are large entities. And it seems that there's human service systems being formed, not only geographically, but functionally, to kind of either diversify themselves, but to ensure that they have, the ability to deliver a continuum of care across multiple different functional areas or disciplines.
Yeah, I just think the challenge remains the fragmented payer landscape for these services.
Okay.
That as long as you've got, DMH, DPH, DES, the Medicaid managed care entities, the ACOs, Mass Health, I'm sure I'm forgetting a ton of them, each of managing the services they provide in a siloed way, which has become less siloed, to be fair, over the last couple of years. It's very hard to imagine a truly value-based world around some of these services. We see some bright spots. There's with the accountable care organizations, which is a whole thing we don't have to get into here. They have a program called the Accountable Care Flex Services, which are based, I think, primarily around food insecurity and housing. And this is basically the accountable care organization, sort of like an insurance company, that is working in conjunction with social service providers to contract out these traditionally, social service functions, and do it on a per member basis, which is pretty exciting. We're seeing some of that, but it's going to take a long time. And I don't think we should be too unrealistic about how fast that's going to happen. That, however, does not prevent these organizations internally from restructuring themselves to be a little bit more nimble and de-siloed internally. So.
Yeah, so they're ready for that change if and when it comes.
Exactly.
Yeah, no, that's a great point. So I always like to end our discussions on a high note or a bright spot. You know, any great stories or bright spots that have come out of the past 3 months, because we got to spread some good news.
I mean, that is a tough question right now, where we're at in the country and the world. I think that we have accelerated technology adoption and reform of our delivery system for health and human services 10 years easily. This industry is so change averse that there was not likely to be this sort of, I compare it to, my son is at home, obviously, he's in 3rd grade. And, if I was a helicopter parent, I'd be kind of freaking out about what that means educationally. But right now, everybody's home. And that'll change in the fall potentially, but he's not doing any worse or any better than anybody else because everybody's struggling. That's kind of what's happening. Every single organization had an abrupt and mandatory adjustment into this new world. There's nobody, was sort of ahead of it necessarily. Again, we had like 1% telehealth adoption. So there really wasn't huge differentiation within organizations in that respect. What'll happen though, is those organizations that kind of revert back to the mean after the acute challenge is over, I think will find themselves totally outcompeted by those that benefit and learn from this situation, because the skills they're building now are going to be skills that are valuable in the future. So I think we're going to end up with a cohort of groups that is significantly more resilient and technically advanced in a year from now than we could have possibly imagined if we were dialing the clock back to, February 2020. So that to me is the big bright spot, is that it opens up an entirely new world of possibilities within these organizations. And it's something that I've been trying to work on for 20 years. So to see it all happen in the blink of an eye is pretty spectacular.
Well, that's a fantastic observation. And Jake, I really appreciate the discussion today. Thank you so much.
Yeah, thank you so much for having me. I really appreciate it. This is a great series that you're doing. So I'm happy to be part of it.
Awesome. So if you are interested in learning more about what Jake is doing or his organization, eHana, please click the link below. As always, please subscribe to hear more great stories, informations, and insights from leaders like Jake. Thank you.
Thanks a lot.